Okay, let's look at how the skeleton is organized. So there are 206 bones in the adult. Now, it's about 206 because sometimes we have extra bones, like they talk about tiny bones can develop between the sutures, and small sesamoid bones and tendons, and then you might have an extra vertebra. I actually do have an extra lumbar. I found that out when I went to the chiropractor, and they said I had an extra lumbar vertebra. All right, so this is what they're talking about, these sutural bones here. These shouldn't really be there, but I mean, it's not going to change anything, but technically this would be 2 extra bones. So here is kind of how it's organized. Here's your axial skeleton, and then here's your appendicular. And so the skull in itself has 22 bones total, 8 cranial, so the face, and then 8 cranial bones and the face, the 14 facial bones. The middle ear bones, you have 2 of each, the malleus, the incus, and the stapes, the small bones in the ear. Your one hyoid bone that floats, it's the only floating bone. It does not articulate with another bone. Kind of interesting. Your vertebral column, all moving down the axis. And then also your thoracic cage, so the ribs and the sternum are part of your axial skeleton. The appendicular, it's your pectoral girdle, so what's holding your arms on, and then your upper arms. And then your pelvic girdle, or I should say your upper limbs or arms. Your pelvic girdle is what holds your lower limbs on, your legs. And so adds up to 206 bones. So the skull has the cranium and facial, and we have middle ear, hyoid, vertebral column, thoracic. This is all just what we saw written different. So in orange, you see your axial skeleton, and in yellow is the appendicular. And so generally speaking, when you talk about the skull, it's made of the cranium and the face. Your hyoid is floating right below your skull. It's what attaches the muscles to your tongue. When you swallow, you can actually feel it move up under your chin. And then you've got, so your clavicle, let's just keep with axial right now. So we have our sternum, and we're going to learn about the parts of the sternum, and then the ribs, the true ribs and the floating ribs. We have our vertebral column in the back with our sacrum and coccyx, and that would be the axial skeleton. The appendicular skeleton will include the clavicle and the scapula, which is the girdle that holds the arm on, which is the humerus, the radius ulna, the wrist bones called the carpals, and then the metacarpals, which are the bones that go through your palm, and your phalanges are your digits. And you have different types of phalanges, proximal, medial, and distal phalanges. Except for the thumb, there's no medial, just proximal and distal. When you look at the pelvic girdle, you have your hip bone. We'll learn the parts of the hip bone. And the femur, tibia, fibula. The tarsals are the ankle bones. The metatarsals are synonymous with the metacarpals. And then the phalanges, distal, medial, and proximal. So that's what I was talking about, the hyoid bone and how it's floating. It's not articulating with any other bone, and it is used to attach the muscles of your tongue. So there are other terms used to describe structures on the skeleton, and you won't be responsible for learning all of these. I kind of think you should, but until they tell me I have to teach this or you have to be responsible for it, we're not. But there's a few I want you to star because we see them come up a lot. So condyle is one, and it is a rounded process, We're going to see it usually at the epiphysis of a bone where it's going to articulate with another. And then a foramen is an opening through a bone, and it usually is for blood vessels, nerves, and ligaments. The foramen magnum is a magnum, large hole in the occipital bone, and that's what your brain and the spinal cord comes out from your brain, pretty much at the bottom. And then a head is an enlargement of the end of the bone, like the head of the humerus. Let's see. A meatus is a tube-like passageway. Let's see. A sinus, you should know that's a cavity within a bone. A suture, you should know that, interlocking line where the bones are connected. We'll see some on the skull. And I think that'll be good. All right, so let's get to it. The skull is the cranium and the facial bones, and we'll look at some of those facial bones and cranial bones come together to form the orbit of the eye. In these bones are air-filled cavities called paranasal sinuses, and they help reduce the weight of the skull and help resonate your voice. So, all right, the front bone of your skull is the frontal bone, and then parietal bone are these side purple bones. Here at your temples is actually the sphenoid bone. Temporal, don't think that's at your temples because it's talking about tempo. And how do you know the tempo of music? You hear it. So this is where your ears are going to be. So think about tempo and listening to music with your ears. Sphenoid is at your temples. All right, we have nasal bones, a left and a right. You've got this maxilla, just the one, and the mandible, so the jaws. So we also have the zygomatic bone with the zygomatic arch. These are your cheek bones. And then in the back, we can't see that, so we'll have a look at the other side of the skull so we can see the back. Okay, right here in the nasal septum is your vomer, and it actually just looks like a thin piece of bone, but it does have a floor to it, so we'll see that. And then so right here is your lacrimal bone, and so lacrimal, lacri, it's where your tear ducts are. And then ethmoid bone is going to be back there. So if you put your fingers in the corners of your eye, you're touching lacrimal bone. You can't touch ethmoid without going into the eye socket. And in the back, you can see where the sphenoid bone has an irregular shape. It goes all the way from the temples, and it's going to go into the medial part of this skull. So you can see that it forms the back of the orbit. Okay. The coronal suture goes all the way around, and so think about it being like a crown on the top of this person's head. The corona means crown. And squamous suture is the one that's going to go around the back. We'll see it better on this side view. All right. So there's that coronal suture I showed you. Frontal, parietal, temporal, sphenoid. There's lacrimal, ethmoid, zygomatic, maxilla, and mandible. And then we have our occipital. The sutures I would like you to know: coronal, squamous, and lambdoid. Now, anytime we use the word process, it means a projection. So the zygomatic process of temporal bone. So they're talking about the temporal bone, and it is a process that's going to connect with the zygomatic process. So here's the temporal process of the zygomatic bone. So these are projections where they connect. Here's a styloid process, poking down. I think about if you have style, you look really sharp, and that's a sharp-edged bone. So that's the styloid process. And then your external acoustic meatus is where your ear hole is. And then your mastoid process is here. This massive process, this big projection coming out on that temporal bone. Please know those. Those are going to help us later on, and you might have to identify some of these on your test. So when we look at the eye orbit, we already noticed that it's made of the zygomatic and the sphenoid and the ethmoid lacrimal, and even a little piece of the palatine. We haven't seen that yet. It's central, and then this maxilla. Oh, and of course the frontal. So all of that makes up the orbit of the eye. Our paranasal sinuses, there are 4. The frontal bones, the maxillary bones, the sphenoids, and the ethmoids all have sinuses in them. When you don't have a sinus infection, you don't feel heavy there and don't have pressure there. But when you do have an infection, fluid fills those spaces and changes your voice and makes your head feel heavy. Okay, so this is just putting things into words, but really we just need to identify these things. So what you're looking at is the inferior view of the skull. You're looking up, and here is that foramen magnum, that large hole in the occipital bone where your spinal cord is going to come out of. The occipital condyles are here. This is what's going to attach to your vertebrae and hold the head onto the neck. There's that styloid process and that external acoustic meatus. Okay. Remember the vomer in the middle of the nose? So here is the floor of it. Kind of funky shaped. And then speaking of funky shaped, look at this sphenoid bone. Here is where it was at our temples, and then it was made up part of the eye socket, the orbit, and then it's got this very funky shape, almost like a butterfly. The ethmoid bone also looks very weird shaped. All right. Right here, is the palatine bone. Yeah, I was like, what? I was looking, and this is, so here's that palatine, and part of it makes up the eye socket as well. So where is this? You actually can feel it on the roof of your mouth. So most of the roof of your mouth is going to be maxilla, and then you go further back and it's palatine. And then you go so far back, you're not in hard palate, you're in soft palate. But you see all these like jugular foramen and carotid canal, those are for arteries and veins to go into the brain. So here is the sphenoid and ethmoid bones. So sphenoid and ethmoid, they're just look like a butterfly, and then I don't know what this looks like, but real weird shaped bones. So this is just looking into the nasal cavity, and you can see that nasal bone, and you're looking at the ethmoid bone here, and it's forming these ridges in the nose. We won't talk about those too much this semester. That would be in Anatomy 2. So looking down into the floor of the cranium, there's that foramen magnum, that's where the spinal cord's attaching, and you see the sphenoid bone, the temporal bones, parietal, and occipital frontal bone, and then the ethmoid, part of the ethmoid. All right. So I'm skipping a lot of this. It's just describing in words, but like I said, you'll need to know some labeling. Just another section of the skull to look at the mid-sagittal view, and you can see these bones that we have talked about. And that's looking into the front. It's kind of weird. Technically, like that's like your mask. You could put it up in your eyeballs. Let's be there. Oh, Lord. Mandible is your bottom jaw. Okay. In infant skull, it is incompletely developed at birth. So you usually have a small face with kind of a bigger head, right? And the bones are very thin and somewhat flexible. The sinuses are not completely formed yet. And you have soft spots, fontanelles. And these are fibrous membranes that are connecting these cranial bones, and ossification is incomplete. And so it allows that skull to change shape while it goes through the birth canal. Usually close up between 2 months and 2 years. And so here's the anterior fontanelle that most people think of. It's a large soft spot on the skull. All right, let's look at the vertebral column that holds that head on. It consists of many vertebrae of different shapes, and for our class, you're not going to need to identify them based on their shape, but the purpose of the vertebral column, of course, is to hold the head onto the body, but also protect the spinal cord that's located in the vertebral canal. In infant, there are 33 separated bones, but some of them fuse, and we only have 26 in the adult. Now we have these different curvatures. There's the cervical curvature, the lumbar curvature, and the thoracic curvature and the sacral curvature. Now I said those out of order because, well, I don't know why, but there's primary curves and there's secondary curves, and that's just showing, saying that the cervical curvature and the lumbar curvature curve the same way, and the thoracic and the sacral curvature curve the same way. And we'll look at that. So there are 7 cervical and 12 thoracic, 5 lumbar, and then 5 sacral vertebrae that are fused together to form the sacrum, and then coccygeal vertebrae that are fused to make your coccyx, your tailbone. So this is that secondary curvature and the other secondary curvature, and this is that primary curvature that curves out, and this is a primary curvature that curves out. So that's what I was talking about. So here are the 7 cervical vertebrae and the 12 thoracic, your lumbar, sacrum, and the tiny coccyx at the end. So they talk about the parts of a vertebrae, and so put an X on this because we are not going into the different, not too much. Maybe this a typical vertebrae. Yeah, this would be good to know. Here's a process, right? On your spine, it pokes out. And then transverse on the sides, these poke out. And then here is the foramen, the hole, and the body would be the major parts you would want to know. Sorry. Okay, we said the 7 cervical vertebrae. Well, we know that the cervical region is our neck region. These are the smallest vertebrae. And the first one is called C1, and it has its own name. It's called atlas. And that is what is articulating with those occipital condyles that we saw poking off. I told you this would connect with the vertebrae. It connects with C1 called atlas. The second vertebrae, C2, also has its own name called axis, and it allows your head to pivot. And so they have specific shapes and things. Don't worry about put an X through that. But the rest of them would be C3, C4, C5, C6, C7. Only C1 and 2 have specific names, and that's atlas and axis. And if you need a way to remember this, these are in alphabetical order. That helps me. Okay. There are 12 thoracic vertebrae. Thoracic is chest, and they all articulate with your ribs. So you have 12 ribs on either side, and they're all articulating with your 12 thoracic vertebrae posteriorly. Below them are 5 lumbar vertebrae, unless you're Mrs. Barker, and then you have 6, and that is the small of your back. They're very large-bodied because they are weight-bearing and thick. And so you can kind of see that the thick-bodied lumbar vertebrae. Last, we have our sacrum and our coccyx, which is our tailbone. And so that is a picture of your sacrum, and the coccyx is this piece right here. Almost looks like a rattle on a rattlesnake. And so here is a table of the bones, how many there are and their special features. There are some disorders of the vertebral column. So you might have heard of a herniated disc, and this is a break in the outer portion of the intervertebral disc. And so we're talking about that cartilage that keeps the vertebra from hitting each other, and this could compress some spinal nerves, and that will cause some issues. Kyphosis, scoliosis, lordosis are all abnormal curvatures of the spine, and then compression fractures of your vertebral bodies do happen with age. As those discs become rigid and shrink, you can accidentally fracture a vertebrae. So let's talk about the thoracic cage. We're still in the axial skeleton, and this is going to be the ribs, the thoracic vertebrae they attach to, the sternum that they attach to anteriorly, and then the costal cartilages that allow them to attach to the sternum. They do support the upper limbs and the pectoral girdle and protects the abdominal viscera, so everything inside, and do help with breathing. So humans have 12 pairs of ribs, and we have true ribs and false ribs. True ribs connect directly to the sternum, and false ribs don't. They don't have their own cartilage. So there's vertebrochondral ribs, and it's where when I say they don't have their own cartilage, these are stealing the cartilage from the true rib number 7. I'll show you in just a second. And then you have the lower two that are floating ribs because they don't connect to any cartilage at the front or the sternum. And so remember, this is a flat bone, and we're again using costal cartilage or hyaline cartilage to connect them to the sternum. So when you look at this rib cage, this is our first rib. So you follow it around, and it is attached to our first thoracic vertebra. So T1 turns into rib 1, and then this would be the costal means rib, cartilage that attaches to the sternum. So here's our sternum. So that's rib 1. Here's rib 2. Here's rib 3. Right there. Here's rib 4, 5, 6, and 7. See how 7 has its own cartilage here, but then 8 borrows cartilage from 7 and 9 and 10 as well. So all of these cartilages are attached to the 7th rib's cartilage. This is costal cartilage made of hyaline cartilage, that connective tissue we learned in our tissue unit. Right here you see these bottom 2 ribs, one technically 11 and 12. These 2 are your floating ribs. They don't attach to any cartilage and never come to the front. And this is what your x-ray looks like. So these are your clavicles, and then you've got these ribs. And so this is what a typical rib looks like and how it articulates with the vertebra in the back. And then in the anterior end is where it'll attach to, if it's a true rib, to its costal cartilage. Your sternum, also called your breastbone, you do need to know that it has 3 parts: the manubrium, the body, and the xiphoid process. Remember, process is a little projection that pokes off, and it does articulate with those costal cartilage ribs and the clavicles. So the pectoral girdle, your shoulder, is your clavicles and your scapula. Scapula sounds like a scalpel, which is a blade that you can dissect with. So a shoulder blade, scapula, might help you remember. And then so this forms a incomplete ring open in the back, and that supports your upper arms. And so if we look at this, here is our clavicle, and then the scapula, and those come together, and that allows articulation here for our upper appendages. And notice where it's also on this manubrium. So here's the manubrium, part of the sternum, and then the long part's the body, and then the little end piece is the xiphoid process. Let me show you that real quick. So right here, xiphoid process, the majority of it is the body, and then the top is the manubrium. All right, so here is your scapula or your shoulder blade. All right, let's look at our upper limbs. And so the upper limb is your humerus, radius, ulna, carpals, metacarpals, and phalanges. And so here's your humerus, your radius, and ulna. So you can remember that your radius, I think of rad, and I do a thumbs up. The radius is always in line with your thumb. And the ulna is a little bit like skinnier, smaller bone. And so when you twist your arm, this is what happens. The radius actually moves over the ulna. They cross over, kind of neat. Your carpals, wrist bones, your metacarpals, the ones that will be in your palm, and then your phalanges. So this would be a proximal, a medial, and a distal phalange. In the thumb, it would just be proximal and distal. And this is showing the elbow joint. So here's your humerus and it articulating with the ulna and the radius. And I said that wrong, radius and ulna. Sorry. Humerus, only bone of the upper arm. It does have a head and all kinds of parts. So here is the head, the anatomical neck. Like I said, not going to learn all of those parts for this course. So radius is shorter than the ulna. It is the lateral forearm bone, the one that is to the side if you're in anatomical position. So it lines up with your thumbs. And the ulna is the longer of the two bones and is medial. And so here are those, radius and ulna. All right, the hand, we have our wrist, our metacarpals, our carpals, metacarpals, and phalanges. And phalanx is singular, so phalange is more than one. That's the plural form. You do need to learn the bones of the wrist, and there is a saying in your book that helps you learn that, and you can Google. There's a bunch of different ways. I think in the PTA program, the students come up with their own way to memorize these, but it's the scaphoid, lunate, and I can't say that one, pisiform, hamate, capitate, trapezoid, and trapezium. And so here those are the carpals, metacarpals, always starting with the thumb, numbered 1, 2, 3, 4. Phalange, so if you had said the second distal phalanx, it would be finger 2. Distal phalanx, it would be this bone right here. And you might pause the video and go ahead and look at these bones of the carpals. Then we look at the hip and the pelvic girdle, which is your sacrum. Your pelvic girdle is your hip bones, and then the pelvis is the coccyx, sacrum, and the pelvic girdle, the hips. So this is what allows legs to be attached, which is interesting when you find out that whales have hip bones, but no legs. Anywho, so here is the pelvic girdle. So it's attached to the sacrum in the back. And coxal bone is another name for hip bone. You do need to know the 3 parts of this hip bone. So the ilium is this big, I think of an elephant ear to help me remember ilium. And then your pubis is going to be right here. So the pubis area is going to form your pubic bone. And then the ischium is what you sit on. So this is the ischium, pubis, and ilium of your hip bone or coxal bone. So it talks about ilium, ischium, and pubis. The acetabulum is where the head of the femur binds, and that's this part right here. Notice it's got hyaline cartilage because we're going to have articulation here. This pubic symphysis holds these two pubic bones together, and I have heard of somebody this breaking, and these bones separate and you open up like a book. It sounds awful. All right. And so here, ilium, ischium, and pubis, and then acetabulum right here. So you have the false pelvis or upper pelvis or greater pelvis, and then the true pelvis. And we don't really test on these, but what will be on the test is the difference between the male and the female pelvis. So the female pelvis is important because it functions as the birth canal, and so it has to be more broad. The bones are more flared. The pelvic cavity is much wider. The pubic arch angle is greater. There's more distance in there, and it's lighter in weight, where males are less flared and heavier in weight. And so you can see here the male has a much smaller space than the female, and the hip bones are flared out more laterally. All right, the bones of our lower limbs, we have our femur, our patella, our tibia, our fibula, the tarsals, the metatarsals, and the phalange. Femur is the largest bone in the body, and connects with the tibia and fibula at the knee, where the sesamoid bone, patella, is located. Your fibula is kind of posterior to the tibia. The tibia is larger. Think about a fib is like a small lie, so it's a smaller bone, and you keep lies behind you. Like, don't do that. So tibia in the front, fibula, and then you have your tarsals. We won't learn all of the tarsals, just a few, but you do need to know metatarsals and phalanges, same way as we did the digits on the finger. So where the femur, the tibia, and the fibula come together, the patella kind of floats here in front. And we'll focus on joints in the next chapter, so I'm not going to spend a lot of time there. But so here is our femur, and you can see where the hyaline cartilage is where it is going to articulate. So here's where it would fit into the acetabulum of the coxal bone. And then the patella is that flat sesamoid bone, and it is, of course, on the anterior part of the knee joint. And the tibia is your shin bone, and the fibula is non-weight bearing, and it's a long, slender bone towards the back and side. And so here's your tibia and your fibula. And so it would be connecting to the femur here, and then our tarsals here. So the ones I want you to start on the tarsal bones is calcaneus is your heel bone, and the talus is what articulates with the tibia. Okay, so you're gonna go tibia and then talus, and then it's gonna be these ankle bones and the heel, the calcaneus. All of those are tarsals. The metatarsals are the bones of the foot, and then you get to the phalanges, proximal, middle, distal. And so here is that calcaneus. You can think of, somebody told me what they said to remember this, and I can't really remember it right now. But here's that talus bone. It's a large bone, ankle bone, that tibia is sitting, articulating with. And then you've got your other tarsal bones, and then here's your metatarsals of the foot and your phalanges. So here is that talus and that calcaneus, tibia and fibula. My dog is snoring, so my apologies. And then here's the top of that talus. Look at that hyaline cartilage that to help protect it from the tibia. I love that. That's a good shot. So as you get older, your calcium levels do fall. Bones can become brittle and prone to fracture. Please keep moving when you're old. When you stop moving, you stop living, honestly. As you get older, your osteoclasts outnumber your osteoblasts, so you're no longer building as much bone as that you're breaking down. And hip fractures are common, and vertebral compressions also show up. And that is the end of that chapter. We will look at the next chapter on joints to finish out the unit.